Let's start with these protests. Describe what they were like.
Well, we had for a few days before, I was informed that there were some active social media people recruiting protests to come for that weekend to protest the masks and vaccine mandates outside of my house. And we ended up on a Sunday evening with a small group of people. I tried to talk with them, and once I recognized who they were, we had a plan in place. And I notified police and just having a police presence because of some of the individuals involved. But then they stayed well into the night, and they were making random phone calls. They had put our phone number up on social media.
Robert? Hey, Jim.
I think you have the wrong number.
We have a son with a complex disability, and sleep has long been a challenge with him. And so we were, anything that disrupts his sleep. And so these phone calls were very disturbing. But just having the presence of these people, and there was 3 nights in a row, caused significant stress to my family. And I think a line was crossed. It's fine, disagree with my work, and there's appropriate channels to bring forward that disagreement. But taking harassing behavior outside of my private residence with my family involved has certainly crossed the line.
Yeah, I think most people would agree that somebody's home is crossing the line. Why do you think that happened? Why do you think the protest took that kind of form?
Well, I think this was linked in with this was shortly after the truck protests in Ottawa, and this group who were unhappy with measures, vaccine mandates, restrictions, masking requirements, those kind of things, which were certainly from a public health perspective necessary to minimize the impact of COVID. And I think that growing opposition to that was driven by events south of the border here, which allowed that kind of expression to be more, I guess, open, and people willing to take that. I think that was all behind people feeling this was appropriate to raise these concerns in front of my home.
And it wasn't just you. I know that this kind of thing has been happening with other medical health officers, doctors. I was at an event where your counterpart in British Columbia, Dr. Bonnie Henry, was speaking, and she had a police officer with her. Pretty rare in Canada for a public official to be accompanied by a police officer. And so I know one of the things you're concerned about is the chilling effect all of this has had, will have, on people willing to serve roles like this.
No, I think it's a serious concern that we need to collectively. It's not just people working in public health and chief medical officers, but I'll start there. People are looking and going, well, why would I want to maybe grow my career and be a chief medical officer of health when I have to deal with we're often the front out front in public on dealing with issues like this. But people don't appreciate that governments work because of people willing to go into civil service and public service. And also our democracy works because people are willing to go into to run for elected office. And I see more and more stories about how people, especially women, and so there's a gender aspect to this as well, do no longer want to even be in public office or would even consider running for public office. So the potential implications of this are quite significant for functioning governments and a functioning democracy. It's not just harassment of some individuals. There's much more profound issues here.
Yeah, and I should point out, you didn't come to us asking to talk about this. We reached out to you because of what you've gone through and how much thought you've put into this. And so let me ask you, Dr. Strang, what do we do about this? What do we do with this erosion of civility?
I don't have all the answers, but I think the starting point is to actually have really open community social dialogue about this. What kind of communities, what kind of country do we want Canada to be? I certainly believe in a place where certainly protests and voicing your opinion, even to the extent of protesting, is absolutely an important and accepted and should be an accepted part of a democracy. But there are legitimate and appropriate ways to raise your opinion, make your voice known, including legitimate and appropriate ways to protest. what happened outside of my home and to many of my public health colleagues is not protest. It's absolute harassment. So that's the first point. But how do we actually, in a world, including Canada, that's becoming more polarized, and there's less and less room for nuanced, complex debate on very complex topics, where we need to be able to respectfully talk to each other, even when we may disagree and have different points of view. That's a conversation all Canadians need to be involved in, because it's at the core of what kind of country we want to have.
This pandemic was a once in a century event. And so a lot of stuff in the emergency kind of reaction, people were kind of learning as they went along. And so in those early days, you and the other public health officers were available on television. You know, sometimes it seemed like every day, certainly every week, explaining what you were doing. And at the same time, you were at the forefront of some pretty major decisions, shutting down borders between provinces, telling people they couldn't have family members come and visit them. As you look back at it, is there anything that, you know, next time, I hate to say next time, but sometime there will be a next time, should be done differently in terms of communicating all of this or having this conversation with the public?
So I think that a couple of things on that. That I was in a fortunate position that at the time, at the early times of COVID with Premier McNeil, that we had lots of discussion and some disagreements behind closed doors. But when we came to agreement on things, and he took the political position that the health and safety of Nova Scotians would come first. So I think one of the things is having that kind of unified voice between a political leader and a public health leader, and that was an important part of generating, for a couple of years, very good trust for Nova Scotians. That's one lesson. The other one is we need to continue to work on helping the public understand that in any event like this pandemic, the science and knowledge evolves, and then we have to and need to adjust our response based on how both the pandemic evolves and things like vaccines come online, but also as the science and the knowledge of the vaccine evolves. So a decision we made in the early days of the pandemic may no longer be the right decision, a year later. Doesn't mean we were wrong up front. All our decisions were about balancing a number of risks and benefits on both sides of the equation, and explaining that balancing act and how we landed where we landed is important too, so the public understands why we're doing things and what was the basis behind it. It's not just a decision that said you have to do X, Y, or Z.
It's been a long, exhausting 4 years for a lot of us, and I'm sure for you as well. And you continue to be the provincial public health officer. I mean, given all that's happened, given those protests at your home, how are you doing? How's your family doing?
Oh, thank you for asking. I think I've recovered from COVID. I've had some good time to rest and move past it, and I'm eagerly involved in a range of other public health issues. My family has, dealt with some of this, and it was very stressful on my kids. But we've been able to, work through that and to get some help from various professionals around dealing with some of that stress and anxiety. And we're in a good place. So thank you for asking.